the county continues to strongly encourage the non-public schools not to open and follow the lead of the public schools. We are still awaiting guidance from the state. So we still have no metrics, no performance measures, nothing that would be relevant for us in terms of evaluating applications from private schools if they were to come in. And we continue to be concerned about opening without guidance. I mean, I'll point out that there's no other businesses that are allowed to set their own rules for how they open in this climate. And the governor's action is a little bit extraordinary. But so we were hoping they provide the guidance soon, and it'd be good if they could provide us with some assistance in terms of evaluating the applications and inspecting the 140 or so private schools that may decide to open. The good news is some of the big ones have already decided to follow the advice of Dr. Gayles and other important, people, and even Dr. Gupta say this is not the right thing to do. We've been joined by the Anne Arundel health official who recommended that private schools not reopen in Anne Arundel County. So we're not the only ones who feel this is a greater risk than we should be taking.
We continue to monitor not only the daily case count, we monitor the test positivity, but we also look at a host of other types of metrics, including all those on our dashboard that look at the percentage of folks in the hospital and what types of care they're receiving. But we've also noticed as the cases have bounced up and down a little bit in the last month, we've also started to see more significant trends and changes as it relates to age distribution. And one thing of note, particularly given the attention related to activities associated with kids, including schools and sports and other types of things, we've noticed an increase in the percentage of cases in the 0 to 19-year-old age group. Historically, throughout the pandemic thus far, that age group made up a smaller percentage of cases in comparison to others. I think cumulatively, that the age group was making up somewhere between 8 and 9%. Over the last month, both here in Montgomery County as well as looking at the state level, the percentage of new cases in 0 to 19-year-olds has increased to 17 to 18%. So basically, it's almost doubled in the last month. And that's concerning because we're seeing more cases pop up in kids. And we know that can be secondary to more kids being tested, particularly given the different mechanisms to test asymptomatic individuals. But it's also concerning, as the county executive mentioned, is not only are more people getting tested, which is great, we want to test as many people as we can, we also are picking up more cases, and that's problematic.